Hi, today we learned something about Bell's palsy. But before that, let me just give you some introduction about upper motor neurons and lower motor neuron arrangement for cranial nerves and how it is different from spinal nerves. Now, upper motor neuron innervation to lower motor neurons in cranial nerves is bilateral. As you can see this in this figure, these are the upper motor neurons coming from right side and coming from the left side, which innervate the lower motor neuron. So the lower motor neuron is getting innervation from upper motor neuron bilaterally, both right and left. But this is not the case in spinal nerves. Upper motor neuron innervation to lower motor neuron in spinal nerves is contralateral. That is, as you can see this, the right side upper motor neuron innervates the lower motor neuron present on the left side. There is crossing over of upper motor neuron at the medulla. So one might ask that why is this arrangement different in spinal nerves and cranial nerves? The reason for that is the muscles for facial expressions are spread across and there has to be coordinated and symmetrical movement. For example, when you move your mandible, you don't just move it from one side, you move both sides. Hence, the bilateral innervation is important in coordinated and symmetrical movement. Now let me ask you this question. If I lesion one side of upper motor neuron, will there be any weakness? For example, I lesion this right upper motor neuron of cranial nerve. Will there be any weakness seen in the muscles? The answer is no, because the muscle is receiving innervation from both right and left upper motor neurons. Hence, enough innervation is being driven from opposite side, so it has got a backup. So enough innervation is being received from this left side, and hence there won't be any weakness seen with unilateral upper motor neuron lesion. However, there is an exception. And let me ask you this one more question. Which cranial nerve is not getting bilateral cranial nerve upper motor neuron innervation? The answer is cranial nerve 7. The cranial nerve 7 does not receive bilateral upper motor neuron innervation. So let me just explain you with the figure so you will get some idea of what I am talking about. So here is the figure. Now the corticobulbar innervation of cranial nerves lower motor neuron is predominantly bilateral. Just listen to this. It's not that all lower motor neurons do not receive bilateral innervation from upper neuron. No, it's not that case. But the corticobulbar innervation of cranial nerve lower motor neuron is predominantly bilateral, in that each lower motor neuron in a cranial nerve nucleus receives input from corticobulbar axons arising from both right and left cerebral cortex. It's on it's on all lower motor neurons of cranial nerve 7. Only some of lower motor neurons of facial nerve receive contralateral innervation. Now each and every lower motor neurons has a bilateral innervation except for the few of them. Let me explain you through this figure so it be more clear. Now the muscles of facial expressions helps us to wrinkle forehead, shut eye, flare nostrils, smile. Now the nerves which are innervating the muscles which helps us to wrinkle forehead and shut eye is this one. So this nerve supplies these muscles which helps us to wrinkle forehead and shut the eye. Now let us trace this lower motor neuron and see where it is getting the upper motor neuron innervation, whether it is bilaterally or contralaterally. So let's see. We can trace this. It goes up here in this nuclei, and then we can see it receives upper motor neuron innervation from the left side, and it receives upper motor neuron innervation from the right side as well. Hence, I can say that the muscles which help us to wrinkle forehead and shut eye are receiving bilateral upper motor neuron innervation. Hence, this part of face, this upper part of face receives bilateral upper motor neuron innervation. But as I said that not all lower motor neurons of cranial nerve 7 receive bilateral innervation. Some of them receive contralateral innervation. So which is that part of the face which receives contralateral innervation? The answer is this part, the lower face, the muscles of nose and mouth, the muscles which helps us to flare nostrils and smile, receive contralateral upper motor neuron innervation. Now let's see this. Let us trace this fiber. It goes up here in the cranial nerve nucleus and then it goes way up here. So this left part of lower face receives upper motor neurons from the right side. Hence I can say that it is receiving contralateral innervation of upper motor neurons. So let me just repeat this once again so it is clear to you. The upper part of face receives bilateral upper motor neuron innervation, while the lower part of face receives contralateral innervation. Suppose if this is the part of the face, this small part, this left lower part of the face receives in upper motor innervation from the right side, and this right lower part will be receiving the upper motor neuron innervation from the left side. So it is receiving contralateral innervation. Now, after understanding this anatomy, this will help us in understanding different kinds of lesions which occur and helps us in diagnosing the disease. So, if I lesion these neurons, these are lower motor neurons. So, if I lesion lower motor neurons of facial nerve, what will be the pathology known as? It's known as Bell's palsy. Now, what will be the signs and symptoms? The signs and symptoms will be the patient is unable to wrinkle his forehead, unable to shut his eye or flare his nostril or smile, or there is drooping of the corner of mouth. So I can say that when I lesion the lower motor neurons, I am seeing ipsilateral paralysis of facial muscles. So with lesion of lower motor neurons of cranial nerve 7, there is ipsilateral paralysis of facial muscles, and this is known as Bell's palsy. But if I lesion the upper motor neurons, what will be the case? So if I lesion this A as you can see this, if I lesion up here, what will be the signs and symptoms? The signs and symptoms will be there will be paralysis of this part of face because it is receiving innervation from this part. So the patient, this part of the face will be weak, but the patient would be able to wrinkle his forehead, the patient would be able to shut his eye because it is receiving bilateral innervation. So there is enough innervation being received from the opposite side. Hence there won't be any pathology or any signs and symptoms associated with this inability to wrinkle forehead or shut eye. These all will be present in upper motor neuron lesion. Only weakness of the lower part of contralateral face will be seen. Suppose if patient comes to your office and complains that he is having weakness in this part of the face, then where will be the lesion? There will be opposite side, the left side. Here there will be similar picture would be there. Up here the upper motor neurons will be there here, and there will be lesions in the upper motor neurons on the left side, which results in paralysis of the contralateral side of the face. Suppose if a patient comes to your office and he complains that he is unable to wrinkle his forehead or cannot flare his nostril or cannot smile, What will be the pathology? Where will be the lesion? Will it be lesion A or lesion B? The answer is B, because there is ipsilateral paralysis. So Bell's palsy is ipsilateral paralysis of facial muscles, while paralysis associated with upper motor neuron lesion is seen in contralateral lower part of the face. Thanks for watching this video. I hope you have benefit from this video. If you have benefit from this video, hit the like button, share, subscribe, and bye bye until next time.
That you're not here with me. I'm right here.